Okay, so I think we'll get started. Well, we'll continue to get started here. And as I like to say, it's Friday, so it's Let's Get Technical time, and welcome everyone to the call. Seeing some returning names and faces on here and some new people as well. So welcome. We'll do a short introduction and then we'll dive into the topic today, which is critically important topic of, how do we do responsible data sharing, not only before, but during and after the new world that we're living in here. And we have our colleagues and friends from Bright Hive who presented previously, and then we have some other special guests from across the country who will be sharing some of their on-the-ground experience with everyone here. So welcome. Again, my name is Daniel Stein, and I'm from the Stewards of Change Institute and the National Interoperability Collaborative. So Mike, please advance. Next slide. Yeah, so probably little time necessary on housekeeping because people are spending way too much time on Zoom or WebEx or whatever. But the main thing I wanted to make sure is, if you should be muted now. You can sometimes you have to unmute yourself, or you have to double unmute yourself if you're going to say something. Sometimes you have obviously the raise hand feature, and then of course the chat. We're going to try to pay attention to the chat as we go through today, but they will also have the chat log documented as we go through the meeting here. We are, trying to engage, a conversation as much as we can, and certainly afterwards we'll be available on the website to entertain questions and those kinds of things. We are recording the session today, as we do always, and those are all those videos and audios are posted on the Nick Hub. The URL is there that Sandesh has put up for us, and you'll see that. So feel free, now that everybody has exhausted their Amazon and their Netflix, all the movies you've already seen 3 times, feel free to binge watch all weekend. We've got lots of good content up there for you. I'd love to say that underline, but it makes me laugh at least. A couple weeks ago, we started to do some live streaming. And so folks who are on their phone, if you're not able to get to a browser, get to this browser on your screen, because for whatever reason, feel free to check it out on YouTube there. One other comment I just would make for those folks who are showing up as phone numbers, feel free, if you can, just to hover over. Some cases you can hover over your phone number and just type in your name, so we see who you're from, or who you are, where you're from. So it's really easy to do that if you want to be seen and be known. So Mike, please advance. Thanks. So today's agenda is a pretty simple agenda today. I'm just going to spend a couple of minutes kind of reviewing, talking a little bit about what we're up to and how it kind of ties in. And then, as I said, we're going to be focused in a lot on the data sharing with Bright Hive, and then some special guests from Allegheny, Colorado, and the Policy Council. Next slide, please. And I think we got. Oh, just one thing I wanted to mention, as we have a number of events coming up for the remainder of May, and then we're planning our sessions for the summertime. But the handsome gentleman on the slide right now, Dave Walsh, is helping lead our Project Unify, which is a proof of concept that actually is demonstrating, much like today, the exchange of information between different sectors and domains. And we'll be going into kind of a deeper dive on the proof of concept next week, and actually the following week as well, because we have a lot of content to dive into, not only the overview and the architecture, but a lot of the pieces that people are interested in. So we'll have, as I said, next week and the following week, we'll be focusing on that POC, which certainly will relate to today's topic, and also the general topics that we've had going forward. Please advance. One more. Yeah, so we're just going to do 2 quick polls for everyone out there. And Mike is going to put those up, and if you can respond quickly. One is kind of what areas do you focus on? And here we've divided the world into 6 general domains plus other. So human services, public health, education, public safety, healthcare and IT, and then emergency medical response, and then other. So if you would just go ahead and pick your choice, or your choices for that matter, and we'll just get a sense of who's on the line here today. Mike, how are we doing?
We are over 50%. We usually get about 65, 70%. So got about 15 seconds if you want to get your response in.
We want this, don't want to let last week get ahead of us here. Okay, why don't we
Okay. And that one, results? Yeah.
Yep. Okay, great. So dominantly human services and public health, that's great. Welcome friends from education and public safety and emergency medical response. I'm glad we have some folks on there. We're still trying to work on getting more of our public safety people to the calls here, and then healthcare IT. And then other, I'm seeing a number of others that are showing up here. And so we have behavioral health and MCOs and quality improvement, those kinds of things. So and local government, that's great. Thank you. So we got kind of a nice dispersion, but concentration in human services and public health, which doesn't surprise me. One more poll here. This is just to give us a sense of where people are coming from. And Canada is not the Northeast. So feel free to add your commentary there if you're out of the country, so to speak, out of the US. And we'll just give you a few minutes to fill in that. That's always been fun to see who's there.
Yeah, this one goes pretty fast. We're up over 50%. So.
Hope I got to submit myself here. There you go. Don't forget to hit the submit button when you do that. And let's unveil the winners, as they say. Where are people from?
The West today.
Okay, a lot of West Coasters. That's great. Northwest. Southeast, I guess the weather's too nice. Everybody's out on the beaches. So
in the bars.
Yeah, or the bars. A little early for the bars, I think, but and there's nobody from other, which is great. The land of other. Well, thank you for completing that for us. Oh, Texas, yeah, okay, thank you for Texas. I think that fits into the Southwest, I'm not sure, but welcome. Next slide, please. Yeah, so just a couple of words on the NIC for folks who are new to this. I just go through this quickly just to kind of set the frame. Part of the reason, as I mentioned earlier, our charter has been to really focus on cross-domain learning and sharing and information exchange. And we started doing this work for a long time, but a couple of years ago with a generous grant from the Kresge Foundation, we've been able to really concentrate on that and build this out, the National Interoperability Collaborative, and also support a number of the other activities, including weekly calls here. And the core idea here is how do we share information across not only programs, which is hard enough in large agencies or large bureaucracies, but how do we do that between domains, between health and public health and education? Because some of the same problems, many of the same problems are trying to be solved, and they're solved in a particular domain, but not necessarily with sort of peripheral vision about who's to the left, who's to the right. If I'm creating a solution, how does it affect my quote unquote trading partners? And certainly now, I mean, we thought, with the opioid epidemic that was the ultimate use case for the need for interoperability across virtually all of those domains and many others. And now with the pandemic, it certainly has become clear that, boy, the needs, being able to address the needs and understand what's happening at any level, the requirement for interoperability really does cut across all those domains and many others that we haven't even necessarily identified. And I'm sure Matt and company will say, well, why isn't workforce on there and labor? So again, I'm not trying to boil the whole ocean, but so that's really the idea of the NIC, and we are excited and delighted to be able to bring more voices into that and to drive that over time. So today's presentation is very much about that as well. And you can find more about that on the site. There's a report that we had done for and with HIMSS a couple of years ago, and kind of outlines that. We'd love to do some cross docking of those things and really look more deeply at those places where standards, where knowledge, information, technologies, and other sorts of things, policies are lining up. So this is the this is kind of our view of where where we're headed over the next number of the rest of this year and into next year, which is obviously there's a tremendous amount of uncertainty, of change, of disruption. This is the disruption of our lifetime, of our generation, probably. It will be one of those things. I was just commenting to friends the other day. This is one of those things we'll look back in, 50, 150 years, 200 years, and we'll say, well, the great epidemic of, 1918. Well, we're living through that now. And for those of us who haven't had to live through a major world event like that, this is our event. So there is clearly both a tremendous challenge we face, but also a very significant opportunity to maybe make the kind of changes that only happen once in a lifetime. This kind of structural displacement, what's become clear now, the fact that people are talking about social determinants. Just yesterday, I saw from the CDC, they talked about, providing information about where you live, learn, work, live, and pray and play. Those are directly out of the culture of health learning in the social determinant world. So those things are significant and really dominant for many people. So let's go back to this slide for one moment. One of the things we're really focused on here is what is happening over the next 9 months, and how do we help sort of facilitate that conversation about what are the structural kinds of changes that we might be able to make, or the recommendations for actionable change that we might be able to make as we have this holistic perspective on the world. And that's a significant opportunity. It's a tremendous challenge to line up those things which could actually change that proverbial, that aircraft carrier. Can we change the trajectory in a way that makes significant change in how we exchange information, how we do it responsibly and safely and securely and ethically? And in many ways, that is really the purpose of today's conversation. Is how do we do that? How do we bring and align those voices so that we actually have a roadmap going forward? And we'll be talking about that over the summer, and we'll be bringing people together hopefully in January 2021. Our tags and our information are here. I'm sure you've seen that. And so I want to transition now to Matt. One of the things I said before, Matt, one of the things that I've observed just recently, it's become clear to me, is that as a result of this pandemic, for the first time, I think that me and many other people across the country have been introduced to calculus. The fact that exponential growth was a topic one would avoid assiduously in upper level math courses. But we've now had an object lesson in, I would say, calculus, and the fact that change doesn't happen linearly, change happens exponentially. We're all experiencing that. And what does that mean? I think it's fundamentally exciting and terrifying to think that that's our new paradigm, and that what is our response to exponential change, and how do we think about that, because that's what we have to deal with going forward. And I think people now have a better sense of that than they've ever had before. So the nature of the game has changed. So as kind of an introduction, I want to welcome you again back to the Hub and the great work you're doing, and just ask you to say a few things. What's on top of your mind, and what's happening at Bright Hive here?
Well, so Natalie and I and our partners are excited to get to speak with the whole community today and share a little bit about what we've been learning and what our partners have been learning over the last month and a half. I think two things really for me have been really important observations that have changed, reoriented my thinking a little bit. I'm curious to take Natalie's thoughts on this. One, I think, Daniel, you're gonna really appreciate the interoperability kind of emphasis here. We've been engaged with a major national foundation who's trying to figure out how to make better investments in data, right? Across K-12, post-secondary, and workforce. So in that education checkbox. And the core thesis there for the investment has been, let's tie the investments to actual drivers of demand from practitioners in the field, what they need right now from data. And so the first thing we did is just send out a survey to thousands of teachers and principals and district staff and just asking them what things they needed to know. And the interesting thing about this survey is that it went out before, during, before and during the crisis. So we kind of got to see how responses changed over time. And the surprising thing was that there was one thing that was at the top before the crisis that only increased in its total relevance to that particular community. And it had nothing to do with student achievement or how they were doing on their standardized test scores. It had to do with the entirety of their supports, the health supports, the community supports, the social services around the children and families. And that was the number one thing that practitioners in the field felt that they wished, they hoped that the data could help support them better on. And we've only seen that increase as a result of the crisis. And so I think that again anchors to the core mission of this group and the work that you guys are doing, and how important it is across fields. And then the second really has been that we've over the last several months gotten pulled into a lot of conversations around responsible data use with cities, states, national governments, technology companies, academic institutions, and a lot of civil liberty organizations. And what's true across all those conversations is that we are seeing we're seeing a collective almost renegotiation of the social contract around data in real time. And I think that's the stakes right now that we have, and that groups like this, the leadership that all of you guys represent in that negotiation is, I think, incredibly important. And so we're excited to share some of the things we learned. Yeah, Natalie, go for it. Oh, I saw you were.
No, there's stuff going on in my house, per usual.
Per usual, totally fine. Yeah, so Natalie, do you have anything to add in terms of like intro remarks before we have the rest of the partners introduce themselves?
No, I think you did a really good job. I think the only other thing I might add is that the conversation that we're going to have is really centered around responsible data sharing and what that has meant before a pandemic and what it means today. And one of the things I want to make clear is that I don't think the conversation around responsible data sharing is a new conversation, especially for many of the folks on this call who have had to deal with how do we make data usable and still protect individual privacy and rights. I think what makes the conversation a little bit different today versus post-COVID is that privacy protection has really been around protecting people from government, protecting people from private sector bad actors. I think what COVID has shown us is that privacy protection is a little bit more than that, right? Now we need to figure out how do we not only enable and support individuals in their ability to protect their own data and information and sharing, but how do we protect them? How do they protect themselves? So how do they have the ability to make decisions that support their needs while also enabling them to make decisions around their ability to share and do it quickly without having to take a course and get a deep understanding of data? I think that's the lens that we're kind of operating on, especially when we start to think about things like contact tracing and unemployment, and how do we get, skills that we need to get jobs, and social determinants for health. It's really not just about protecting people from, but it's also how do we get people to have a seat at the table in the conversation. I'd just like for everybody to kind of keep that lens in the back of their head as we have the various conversations today. Because I think that's probably the biggest difference that we had before COVID and what we're dealing with now in the lens of responsible data sharing.
Yeah. I would definitely say that, from the work we've done over the years, that term responsible data sharing, comes from, in fact, the information sharing environment and a lot of work that we had heard originally around some of the data standards, especially right after 9/11, is how do we do that? So it's kind of coming back now in a way that I think is really important. So Matt, do you want to introduce or at least ask folks to say hello and show their face and their name?
Yes, so we're fortunate enough to get to work with a lot of really incredible partners who are really having to figure out for their communities, their constituencies, how to do this right, and do it quickly. And they're the real experts on the call today. And so really excited to have them each get to share their stories and what they're thinking, and how they're contributing to both leadership where they are and the collective conversation. So maybe if we can go Peter, Michael, and Sarah. Peter, take it away.
Sure. Hi, everyone. My name is Peter Sloan. I'm the Director of Research and Evaluation for Trying Together. We're located in the city of Pittsburgh in southwestern Pennsylvania, and we work closely with different counties across southwestern Pennsylvania, and specifically Allegheny County, on providing childcare for families in need across the county.
Great.
Hello, everyone. Michael Vante, Senior Director of Research and Data Governance at the Colorado Department of Higher Education. Very glad to be with you today. We're doing a lot of exciting things in Colorado, working with our partner agencies to meet the education, training, and workforce needs of all Coloradans. And within all of that, trying to reach the social determinants of student success as well. So very excited to talk with you all about all of those topics.
Thanks, Michael. Hi, this is Sarah Jordan. I work for the Future of Privacy Forum. My main remit is in artificial intelligence, but focusing on how do we create a responsible system of data sharing between corporate and research actors in order to facilitate the development of ethical and trustworthy artificial intelligence. So I'll be speaking a little bit later on in this webinar about our experience in establishing an independent review committee for responsible data sharing.
That sounds terrific. Well, I'm glad that we have such a wonderful panel. I think we could probably spend the rest of the afternoon talking. We'll see how it goes. We do have some time. So Matt, let me hand it back to you to go. And folks, feel free to add the comments, questions in the chat. Don't forget to do that. We're already seeing some stuff happening there. So we'll try to address those as we can. And as I said, or afterwards. So. Great.
All right. So next slide. So I think we actually got a lot of this in the preamble, right? We are in a moment where responsible data sharing is not only as important as it's ever been, but salient for a lot of folks in a way that it wasn't before. If you go to the next slide, we're actually seeing it all over the news, right? And it's on everyone's mind. And that creates, I think, a real moment of need and opportunity for communities like this that are really the leaders in thinking about the space to not let a crisis go to waste, and how we use moments like this to really bring forward the vision that I think is in a lot of your guys' minds about the right way to improve society with responsible data sharing. If you go to the next slide. We at Bright Hive, because of the work that we do, we are a public benefit corporation focused on data collaboration. Our mission is to see society's disconnected data responsibly linked and purposefully used as a force for good that increases social equity and individual efficacy. And given that mission, we have been asked by a variety of partners since the crisis started, since it first hit, to help them work through the tangled issues, the challenging issues of responsible data sharing, and everything from sharing of test results for COVID tests at the state level across public and private partners, to contact tracing apps and the sharing use of that data for public health purposes and its constraints, to employment benefits and unemployment insurance. And how do we get individuals both the supports they need as well as back into the workforce as quickly as possible, and as well as a broader set of social supports like childcare. And all of these use cases, some have been kind of unique to the crisis. Some have been things that have been with our social safety net for a while and are suddenly having to solve for problems at a scale that they've never had to solve for before, and with a speed and timeliness that they've never had to solve for before. So that's the context in which we come to this conversation today. If you go to the next slide, it's really, this was said to us by one of these partners that approach us, right? We are used to telling people that we can either share data rapidly or responsibly, right? COVID-19 is forcing us to figure out how we can share data rapidly and responsibly. And I think that kind of trade-off that folks have had in their minds in the past has been something that this crisis has forced us to realize is probably a false dichotomy. And that there we can be responsible, we can and responsive to these challenges. So if you go to the next slide. So today's discussion is responsible data sharing in 4 acts. We're gonna give a brief overview about how we, at least at Bright Hive, think about best practices in normal times. And then say, okay, crisis hits. Let's say you have one of those use cases or another use case that your community has been struggling with. And you don't have really any existing trust infrastructure or governance infrastructure in place. How do you start from scratch and respond rapidly? Then second, let's say you've already got good systems in place that have their own priorities, right? We're going along a certain track. How do you pivot as rapidly as possible to respond to emergent needs to the crisis? And then the last act is really, what is really unique to this crisis that is surfacing new challenges in responsible data sharing, and how might we tackle those together as a community? So those are our 4 acts. Next slide. But first, we would love to just get to know your use cases, your challenges a little bit better. We now know where everyone's geographically distributed and which domains you're coming at this from. Love to get to know a little bit more about that. We've got 4 questions. The first one, real quick, what sector or industry best categorizes your organization or network's work? This is a little redundant with the first one, so we can go through it quick. The second is your organization or network currently responding to in some way to COVID-19? The third, is your organization or network currently leading or participating in some sort of data sharing collaboration with other folks? And we can take a quick look at the results.
We're only at about 30% voting right now. Do you want to, it's still moving, it's going north.
Oh, great. Let's maybe, once we pass 60%.
Okay, we'll aim for that. And we've slowed down just as we hit 40. Maybe we should go for 50.
All right, come on guys, we can do this.
Don't forget to hit submit.
Okay, last call, we're at 50%.
And
Great.
as you're answering that, we'd love to know if you answered yes to questions 2 or 3, if you could put it into the chat or share it in the chat a little bit about your use case. What's brought your collaborative together? What's the challenge that you're facing as a community? We'll discuss them a little bit later. We'd love to have folks starting to share those out.
I just shared. Oh, results are up. Oh,
great. All right, so it looks like we've got just about everyone, 94% of respondents are in some way, working with your networks dealing with the COVID crisis. I think that speaks to what you brought up, Daniel, is the universality of this crisis. This is something that is touching all of us. And it's great to see that so many folks on this call, and I think this is in some ways unique to this community, are actively participating in some sort of data sharing collaboration. So we're excited for you guys to share what you've learned over the course of this webinar. Let's go to the next slide.
Do we want to do the last questions, or is it?
Oh,
one more poll.
One more poll? Okay.
One more poll, yes.
So I did notice that a few people were having trouble hitting submit. So our data, our N may be a little suspect, but people are trying. So
Yeah, that's been the experience. I think when the poll stays launched, sometimes it doesn't clear maybe your cache. So yeah.
Great. So the first question is, obviously, how long you've been at this? Second is, what do you most hope to do with the information and knowledge that you gain from this workshop? This will help us really tailor things a little bit more.
Okay, we're getting close to 40%. Just past 50, so last call for any more responses.
It's great to see some of the use cases that folks are bubbling up in the chat as well. We see there's folks who are exploring contact tracing and impact on workforce management. I think that'll be especially, you'll be especially interested in what Sarah's going to be sharing out at the end of the webinar. Looks like we've got some folks looking at value-based payments in public health. That's really remarkable work. Okay, we've got the poll results up. Great, so we've got a whole range of, it's from seasoned veterans to some newbies to data sharing. It's great to see. And it looks like the vast majority of folks want to learn best practices, but there's also an interest and disposition to share with each other. So hopefully we'll be able to do that in the punctuated discussion points in the talk or in the webinar, as well as through chat. So keep chat active. All right, thank you guys so much for sharing that. That gives us a much better sense of where you're coming from and what you're looking to get out of today. Go to the next slide. Okay, so we'll start Act 1, and for this, Natalie is the lead actress on this. She's gonna take us on a tour of what responsible data sharing looks like in normal times. Take it away, Natalie.
Thanks, Matt. And this is just a snippet of what our very opinionated approach to responsible data sharing looks like. We'll be doing a much longer look and explanation and deeper dive into it in a course that we're putting together with Stewards of Change later in the summer. That'll be focused on data governance and data sharing governance practices. So I just want to be able to introduce to you guys, because the journey we're going to take today is in our normal times. What does responsible data sharing look like? What are some of the best practices and ways that we should be approaching it for a more sustainable approach to data sharing governance? And then how have we had to shift that is where we'll go in the discussion, is how have we had to shift that because of COVID, both if you've already been doing data sharing or if you haven't and you need to start from scratch. So let's go to the next slide. So oftentimes, in our opinion, in a normal world, what it looks like to be able to do data sharing governance is it starts with the what, or it starts with the who. Who do you want to share data with? Who are the people that are a part of your collective, either as a data owner or as an advocate, or what are the roles? Who is involved in making sure that data sharing is successful? And for many people on this call, we have to be able to say, how is it impactful? And then once you define who belongs in the room, who's at the table, and my recommendation always, you make sure the group of people are diverse in the way that they think and approach these problems, you then want to define the what. What are you sharing for? What is your use case? Why do we want to do this? And then once you've defined the who and the what, that's when you can then start to dig deep into what your data governance practices actually look like for your data sharing initiative. Go to the next slide. So before we dig deep into what these look like, what we actually want to remember is that when we talk about data sharing governance, when I say it and when I'm talking about it here, what we're actually thinking about is that collection of practices and processes that collectively describe how we make decisions, how we're protecting data, how we're monitoring the sharing of data. So it's not just an MOU. It's not just the agreement that says that we're legally allowed to share. It is the collection of all things related to how we use it, how we collect it, and how we make decisions around it that you need to care about and think about as you establish your data sharing governance for your initiative or your system or your program. Next slide. And so when we think about what Bright Hive's opinionated approach to this is, what it looks like is starting with that who. What is the problem we want to solve, and who needs to be involved in that, in developing that solution, in bringing that data to the table? What are the barriers to sharing, and how do we break down those barriers to enable a successful initiative? Keep in mind that while we're building this collaborative or building this collective, we have not once talked about the technical solution. Because oftentimes, if you don't take the time up front to actually figure out who needs to be at the table, whether it be organizations that need to share their data and link it, or organizations that need to receive this shared data, who are your partners that can drive impact with the shared data, and who needs to be a part of your minimum viable coalition and understand why this data needs to be shared. All of these things should be established up front, because when you start to talk about your theory of change, it's really about collecting the shared vision. And if you don't have that shared vision, you're going to have to do a lot of band-aiding later. You're going to have to potentially re-look at this solution on a yearly, annual basis. Think about how much time it takes for you to put in an MOU. 6 months to put an MOU in place that's only good for a year to transfer from one person to another, a very transactional solution. Bright Hive's opinionated approach to this is that data sharing governance is a cultural effect. It's a process that is ongoing and should be not only implemented, but examined for impact and usefulness. Go on to the next slide. And we do this because we look at traditional data sharing governance as often limited and under-resourced. It's looking at that immediate problem, and it's looking at bilateral agreements and not necessarily looking at, well, what happens after we've shared? What is the ongoing, the trends that we need to examine? What are the ongoing informational needs that sharing data will bring to us? It's often isolated and imposed upon us by lawyers, by those above, pushing it down upon the people that actually have to make this happen, get successful. And it's often from the self-interest of lawyers. And I don't mean that as a negative. I mean that as oftentimes governance solutions are made based upon risk. Nobody wants to be sued. Nobody wants to lose their reputational risk. And nobody wants to lose their reputation in their communities. So that's what they're trying to protect. And oftentimes the impacts and effects and the usefulness of the data being shared and how we're sharing it are secondary to the conversation. Next slide. So our visions for the future, our goals and our views of what this beautiful world looks like, where we're all sharing data. We all have the information that we need when we need it in the way that it's consumable and in the way that we can make decisions on it. That world looks like a world where sharing, those practices are sustainable. They not only meet the immediate need, but you're looking towards the future of not just understanding how to meet the crisis today for your homelessness community, but also how can this information help you better serve homelessness the homeless community in the future. It's not only looking at how do we serve families and children today, but also how can this information serve to develop the trends and information we need. How do we use it to support the trends and understanding of families into the future? It's coordinated with all the stakeholders that we already talked about to be able to help support a diverse and collaborative solution. And it empowers all levels to be a part of the conversation, and it's group oriented. So it really is a collective where everybody at the table has a say in what's happening. And if people can't hear me, just let me know, because I know my video was stopped because of the sound.
We hear you, Natalie. We hear you.
You're good, Natalie.
Okay, great. Thank you. Go to the next slide. So in a perfect world, what we're really talking about is establishing a collaborative, establishing a set of processes and a data governance that not only defines the purpose of your collective, provides context and background and shared goals. We also have an understanding of who needs to be a part of the conversation and what authorities do they have coming to the table. Accountability is a really important thing when you think about governance, because that's why you come to the table. Who's making the decisions and in what way? And what are your timelines and milestones? And how do you look back
and lessons learned to continuously improve your processes? And then how do you measure your success? And what are your operational plans? What's your cadence? Colorado's, I think it's their Department of Education, actually has a website that lays out their operational plans really well. It says that this is who the governance, this is who's a part of the governance, this is why it exists, and this is the cadence that we've established in order to make decisions and understand where we want to go with the use of this data. It gives your data purpose on a continual basis. And it's a great thing. Go to the next slide. If you have 4 to 6 months to put it in place. So if you have 4 to 6 months to put that process in place, it saves you so much time on the other end. What we're talking about today is not how to do this in 4 to 6 months, but how do you establish responsible governance rapidly? So when you only have weeks or days to put this in place, how do you do this and still can say with confidence to your leadership, to the people around you, and to the people you seek to serve, that you've done this with privacy, protection, and equity in mind, that you've done this while still maintaining those same things that you care about during normal times. So that's what we'll talk about today. So I'm gonna, next slide. So I'm gonna pass it back over to Matt, who's gonna lead us down the lane of how do we start to make these types of decisions? How do we start to establish crisis? How do we start to establish data governance during times of crisis when we only have weeks or days? And take you through 2 different scenarios for that. And I believe we'll have 2 guest speakers that will also be contributing to the conversation. Take it away, Matt.
Great. Thanks, Natalie. All right. So next slide. Near the beginning of the crisis, when it hit, at least in the United States, we had someone say this to us, right? How do we stand up a statewide COVID-19 response website that relies on combinations of data from 3 different government agencies in 2 weeks? And they weren't unique, right? There were a variety of folks that that were in this position. And in the case of this particular constituency, they didn't have any existing data sharing infrastructure or governance in place. They were starting from scratch. Now, the good news is that no one's really starting from scratch. They've got relationships of trust and knowledge that are there that you can build on. And often it's just about finding the kernel that you can grow from. But this was their situation. So if you go to the next slide. And as Natalie mentioned, you know, we at least the opinionated way that we tend to approach in helping communities is we think of building out the BLT sandwich necessary for creating a data trust in context. And as you have to solve the kind of incentive business alignment issues, and business in this category is really, it's not you know, a technology company needing to work with another competing technology company. It's any organization's core business operational and impact model, right? The incentive context in which they operate. The legal issues, right? The existing policy and privacy frameworks that govern the use of that data, and some of the lower level kind of technical ETL, API, audit trail, all of that stuff, right? And if you go to the next slide.
Hang on 1 second, Matt. One quick question. Daniel, I'm curious. Who's the bread?
Yeah, that's you know, that's where we stretch the metaphor a little too far. But yeah, I come up with your own definition of bread. Probably the 2 agencies wanting to collaborate, that can work. Yeah.
Right. That's what I was thinking, is the actual users of it, whether or not it's the actual agencies or the people in the agencies or the people who are actually trying to get information from as well. So it's just it occurred to me that good metaphor, but who's containing them? Who's containing them?
I like it. Yeah. All right. Right. I learned something from you today, Daniel. I'm totally using it from now on. That's fantastic. Right. Heidi recommends actually just more generally the stakeholders, right?
I would
agree.
Stakeholders
are.
That's what I was thinking. I was thinking the stakeholders, or the bottom layer are the ones who want to who want to send the data, and the top layer are the ones who want to receive the shared data.
Ooh, I like this.
They're the people who seek nourishment.
You ought to be able to pick it up. Thank you. Feel free to add your comments to the chat if you have other metaphorical recommendations to help fill that out.
Love it. That was great. Thanks for posing the question, Daniel. Okay, go to the next slide. Now, so we typically are fairly slow sandwich builders, right? We want to be deliberate, get the right, get the right level of kind of brownness on the bacon. Select the right leaves of lettuce. Yeah. Now I'm stretching the metaphor too far. So now, as Natalie put, this is usually a deliberative process, right? And so the challenge that several states came to us with is how do we build that BLT sandwich, right, in a way that's not sloppy, right, that we actually still want to eat, but do it, in 10 days. And so go to the next slide. For us, we feel like a lot of times doing the kind of delicate work of responsible data sharing, weaving things together is it has to be as precise as needlepoint. And what we were being asked is like, how do we like do as elegant and as perfect needlepoint, but also while running a 50-meter dash. And so what we came up with, right, and what we are actively working on with partners here and elsewhere, if you go to the next slide, is, well, one way you can get at it is by having templates and staying within those lines, right? And so that's what we decided to focus on. We pooled together a variety of folks that had the exact same use cases across states or communities, and said, okay, for that use case, what's the template that we can build out? If you go to the next slide. And we worked on building those templates out as rapidly as we could, right? Well-defined, narrow use cases with specific language, standard data sets and definitions, right? So having existing standard mappings can be incredibly helpful in this. Standard data transformations, right? Narrowly defined DAGs, but they're defaulted in the core templates. A common set of ethical principles and privacy rules associated with those use cases and policy contexts. And then the additional kind of mustard on the sandwich, having crisis-specific guardrails, right? That it's time-bounded, transparent. Sarah's going to go into these a lot more in a lot more detail in thinking about COVID and contact tracing data trust in particular. But governance committee composition can be another key piece. So getting these kind of core templates for needlepoint down. Go to the next slide. And then trying them out in a few different contexts and figuring out, okay, where does the template work? Where does it not work? We're going to hear from two of those contexts today, which we're really excited to hear from. And Peter's going to go first. One is in childcare, and the other in employment and guidance. Next slide. What we've worked to do at Bright Eye is to get all of these templates structured and formatted and then available on GitHub under a Creative Commons license, so anyone can use them as a starting point. We want to emphasize, this is a starting point for your guys' legal counsel, your collaborative. But these templates ideally are things that folks in the community can contribute to. And we are actively updating these as we work with other communities to do their rapid response data trusts. And so you'll see it updated. You'll see the kind of template structure is updated like software with major releases after each one. But the goal here is the templates provide the use cases, data requirements, allowable uses, ethical principles, default governance model, and the collaboratives can start with that in the Mad Lib and fill out the contributing organizations, the data, their specific named data resources, derived data sets, and approved users. And that's one way that we think you can do needlepoint while running a 50-yard dash. But let's talk a little bit about how this works in real life. So I'm gonna next slide. Great. So I'm gonna pass it over to Peter. talk about around trying together and the context in which they were operating and what they did.
Thanks, Matt. Appreciate the opportunity to talk to everyone. Thanks for coming. First, I just want to start a little bit, if we go to the next slide, just talk about what Trying Together is and what we do. You actually got one more slide. That's just our logo. We do a lot of, we do work on advocacy. So we've been working closely with local, state, and federal funders as far as how do we ensure that our providers and our kids and children that qualify for a child care subsidy are able to still receive the services that they were receiving before COVID, and that they're getting more, so that teachers are getting paid more, understanding that, you know, in the childcare industry, it's very hard to be financially sustainable. So how do we help out with that? We also do provider growth, professional growth and professional development. And then we also do community resources to both families and providers across Allegheny County. Our biggest project we're working on right now is as Allegheny County moves to yellow phase, which means that childcare centers can reopen without a waiver. So anybody can essentially reopen today. I don't think anyone's opening today, but they're probably gonna open Monday, and you won't need a waiver to only serve essential workers. So we have 650 providers across Allegheny County. And what we're trying to do right now is all the ones that are gonna reopen on Monday, how do we get them that PPE? How do they have enough masks for children, because children over 2 are supposed to wear masks, things like that. So even just with the social distancing and reopening, how are we helping our providers through that? And if we go to the next slide, so kind of like what happened to us is on March 16th, we started working from home, and then within 24 to 48 hours, essentially all childcare centers closed across Allegheny County. Some were allowed to stay open with a waiver, but as they started to close, we recognize the need that there's still essential workers. There's still people going into hospitals. There's still people driving buses. There's still people working at restaurants, providing takeout food and things like that. So those folks still have to go to work. But now that childcare is not open, schools aren't open, who is going to watch their kids? Who are they going to trust when they're not home to watch their children? So we essentially went manual. So it was very time consuming. I had a lot of late nights. We were constantly calling our providers and asking, are you open? If you're open, how many seats do you have available? Did you apply for a waiver? Did you receive that waiver? And we're trying to balance that supply all across Allegheny County of amount of available seats. And then at the same time, on a separate spreadsheet, we are then managing who is calling into our early learning resource center, who is calling in and saying, I need care. I have to go back to work in 2 days. I'm fearful that I'm going to lose my job. How do we manage the demand that's coming in while recognizing that each day that goes on, it's more of a risk to those families? So what we kind of learned about a month ago was that, you know, there's online platforms that exist, and Bright Hive was part of a collaborative that we joined up with, where there was already an existing online platform for providers to input their information, and then for parents to do their own search information and know where the vacancies were at childcare providers, either close to their home, close to their work, or along their commute. So if we go to the next slide, we, you know, we recognize the importance of data sharing, and kind of our closest partner on the early childhood work and subsidy and provider quality was Allegheny County. I had come from there before I came to Trying Together. Allegheny County has a robust data system. They have over 30 sources of data, really including everything from birth records all the way to death records. I think I saw someone in Katie that has questions about and things that Allegheny County is able to use, like court records, criminal records, child welfare, education records, attendance suspension. So I was kind of coming at from that lens of what, how do we take all this data that we have, and then how do we integrate it with the child care data? And then, you know, when you think about benefits of data sharing, one of the things that we wanted to build a platform for was flexibility. You know, depending on who you listen to, we may be, you know, schools may be closed again in the fall or in the winter. We may be asked to stay home and not go outside. So we essentially wanted to understand what, you know, how can we build something so we could quickly turn it around and be flexible to what the needs would be of our families and our providers across the county. Furthermore, analytics. I talked a little bit about how much data collection and manual inputting I was doing. That made it extremely hard for me to analyze the data that was coming in. So how do we be better at using analytics, using the different partners that are sharing data with us, that I can focus on making data-driven decisions and making reports and different things that can help our leadership within Allegheny County do the best job that they can do. And then also real-time updates as well. So you eliminate that phone call into our early learning resource center. You have all the information available online. A parent can just go in, search the data, and make a decision based on that. We still offer the services if they want to call in, if they're not comfortable. If, there something's, they don't have Wi-Fi at their home, we're still there to support them with that. But understanding that some families may have to make a decision at night, and they want to be able to call a provider first thing in the morning and have the right questions that they want to ask with that provider. And then if we go to the last slide, I talked about this a little bit before, but when you bring in a data collaborative, it brings in different perspectives. It brings in experts across the country or the world. So we never go into a plan thinking that we know the most or we know the best. We recognize that there's probably something going on somewhere else that might be better than what we're doing. And that's what we kind of found through this platform that was already existing in Texas, was that we could take that platform, push it back to the work that we wanted to do, but tailor it to our needs. And then also at the same time, when you launch a platform with that and you have data sharing and data collaborative partners, you could really make sure that you're being open and transparent with stakeholders. The process we had when we first got going was you'd have to call in, and then we'd give you the list of providers that were open and had availability. So, you had to kind of trust us. So we want to be more open and more transparent. And I just want to kind of finish with one closing thought. If you think about, I saw a presentation yesterday from a Carnegie Mellon professor, and he talked about how do we maximize, I'm looking for these, maximize return to work. I think that's what everyone kind of wants to do. Everyone's on a different timeline across the country, but we recognize from our perspective, we're going to maximize return to work if we have childcare availability and parent trust in the childcare that's provided, that they trust if they're going to return to work, that their children are taken care of and they're growing both socially and emotionally, and ready for kindergarten when they're done. So I just want to thank everyone for the opportunity, and I'll be watching the chat if anyone has any questions for me. Thank you.
Great. Thanks so much, Peter, for sharing that. Now we want to open it up for discussion, both in chat. So keep chat going. This is really great. But also an opportunity for folks to kind of unmute themselves and pose questions to Peter, myself, or Natalie. So the first topic, what policy problems or use cases is your organization facing? We've got a bunch of folks sharing out. And I would love to maybe have one or two of you guys kind of popcorn your use case and how it actually relates to potentially what Peter and Allegheny County have been facing.
Let me just jump in. This, Daniel, question. Having looked at childcare for many years, it is one of the most fragmented fields, I think, that you could say is out there. So I'm curious, Peter, whether or not you were building on anything in advance of that in terms of a structure, and how did, working in this new template sort of accelerate that from, from an ability to really organize those kinds of organizations.
Yeah, I mean, ultimately, I think, when you think about, who you most going to benefit, it's the children, it's the families. So we kind of have an infrastructure in place where it's like, we recognize these are the questions we want to ask families, and these are the questions that we want to ask providers that we're trying to communicate externally. But when you can bring in different data partners and say, like, be very specific of like, this is the information we need to collect here, and this is how we're going to do it in an efficient way. And then if you're able to build a platform, if those collaborative partners are able to build the platform for you, you can kind of tailor it to your needs. I think a lot of the work that I've been doing over the last month is testing, and not really testing for issues or bugs, but really testing of like, how would a parent interpret this information? Would they have are we asking the right questions, and are we asking too much? And if we're asking too much, then like maybe let's pull back. Maybe let's just get a child's name and what their age is, so that a parent's comfortable sharing that information, that we can then tie that demand data into the supply data.
There was a question from, I think it's Sandhya in the chat for you, Peter, which how is Allegheny County able to join child welfare data with other sources? It sounds like they've struggled a little bit with pushback that they've gotten from their county council around the rules for sharing child welfare data. Is that part of your guys' experience, or?
Yeah, well, I mean, I can say, I mean, way before me, they've been working on a data warehouse since I think about 2001. And the ultimate kind of like contract holder for all the childcare data we receive is Allegheny County Department of Human Services. They're also responsible for child welfare, mental health, housing, aging. So not that aging is super relevant to childcare, but so they already have that infrastructure in place. And now what we're trying to do is take that childcare data we're doing and integrate it with the rest of the data that they already had. But by Allegheny County being the contract holder for both the childcare data and child welfare and other data points, it makes it easy for us to kind of link all that data together. And there's strong support from the leader of Human Service, our Department of Human Services director, but also our overall county executive, in that recognizing that data plays a large part in decisions that we make. And the more that we can integrate that data together, the more that we can make strong decisions. So you can see, if you go to AlleghenyAnalytics.us, and I can put that in the chat box, there's a bunch of different sources of data. Childcare is not there yet. We just started this contract on July 1st, and that was our spring project, and that things have changed for everyone. But there's a lot of different data sources you can see in there, and you can kind of manipulate the data to get aggregated counts of, for example, child welfare, kids that are in child welfare that are also receiving behavioral health services. And you can kind of tie the two pieces of data together and look at different locations across Allegheny County. And that's kind of the basis of what we're trying to do with the childcare data as well. Integrate that with the other data sources we have and make smarter decisions.
Great.
Thanks, Peter.
Yeah, I think we're good on that, or we're timed up on the first discussion. One thing that I'll just point out to you, Peter, in the chat, several folks have brought up the challenge of, I think both Jane and Lisa commented that essentially when you solve the problems in one county or one city, you've done it in one county or one city. You know, each one is its own different kind of animal. So it'd be great to get your thoughts on what you think might generalize beyond Allegheny County, and what you think is really kind of idiosyncratic and unique to county.
Sure, yes, totally agree. I think Allegheny County is a different beast in that way. I had come up from Boston before I moved back home, and things were done completely different. I think as far as best practices, I think it's, I think step one when you're taking in data is you want to recognize, like, how can you be transparent externally? And sometimes some of the stumbling blocks with getting buy-in and getting, council and other things to buy in is that, you want to make sure that you're selling back a use case, that you're selling back examples that you can show them and how things were able to pivot based on the data you brought in. It's like sometimes, you just hear data and it's like, whoa, like, I don't know if I want to be responsible for that, or I don't want to have to monitor the security. And I think just, open lines of communication. I would say, I kind of talk like, oh, we've been doing this since, 2001, and we have a lot of different data sources. But a lot of those pieces of data took multiple years to kind of get everyone comfortable to integrate it across different sectors. So it is a time-consuming thing, but something back to what was talked about at the beginning was like, to me, like, this is now the opportunity. It's, things are changing every day. Things that Matt and Natalie were saying, like, things could be different in 2 weeks. So, you want to be able to use data to make better decisions on that. So if you can use this opportunity to state your case and get access to the data, then you can go a long way to having that access to data after COVID ends, whenever that is.
Thanks so much, Peter. Go ahead and feel free to keep engaging folks in the chat. Let's go ahead and go to the next slide. All right, so now we're going to talk about, oh yeah, go ahead.
No, I was just going to suggest we move to Colorado,
Yes.
looking at the clock here, and hear from those folks, from Michael.
That's exactly right. That's the next topic, pivoting your data collaboration to respond in crisis. Colorado is fortunate enough to have already done a bunch of pre-work on data governance and get things in place ahead of the crisis, and was in a unique position to figure out how to pivot. So I've go to the next slide. We'll skip it. They had set up a data governance board to be able to respond to crises like this. So Michael will go ahead and share a little bit about Colorado's experience, how to respond rapidly when you've already got some governance in place. Next slide. Great, Michael, take it away.
Yeah, thanks everyone. Again, it's a pleasure to talk with you all and think with this great community about these extremely important topics. Again, Michael Vante at the Department of Higher Ed in Colorado. We've been doing a lot of work in being able to, as I said in the beginning, link these education and training opportunities to workforce outcomes, being very mindful that in order to provide a great experience for Coloradans when they're making these decisions about their education or whatever their workforce might look like, being able to do that with as much information as they have available. So next slide. One of the things that we've been working on with some of our partner agencies in Colorado is My Colorado Journey. It really is this groundbreaking platform that brings together our Department of Labor and Employment, our Department of Human Services, our Workforce Development Council at the statewide level, and also the Colorado Community College system. So bringing all of these partners to the table. So as Natalie said in the beginning, being able to identify these folks who are very interested in similar use cases, being able to best inform education and training opportunities, and also providing those supports services to students and really meeting those social determinants of student success and worker success, and being able to embed those in a singular place. I think it's really helpful to know that there are a lot of people from government agencies or different people who are working with the government on this call. I think it's a unique perspective when we're thinking about these shared responsibilities and shared goals. So one of the things that we did is when we were envisioning the My Colorado Journey experience, we had all of these stakeholders at the table being able to say, what is our grand vision? What is that broad use case or use cases that we really want to see a movement on, and being able to help move the needle forward on a whole host of these things, whether it's personalizing pathways for individuals or creating these comprehensive supports for whatever a person might need along their journey. And thankfully, Bright Hive has been one of our partners in that work, and we're very thankful for all the things that they've been able to do for us in helping this set up this whole system. So next slide. One of the things that one of our priorities within all of this work has been to increase the impact of the great work that a lot of agencies are doing. So when we were starting all of this work, there was a lot of organic energy around different projects and within different agencies to do various types of data sharing. And one of the things that we hope to do is kind of corral those cats together and be able to do things in a more aligned and streamlined way, all to really increase the impact of the work that we were all doing, especially in light of fewer resources. I know in talking with, I'm sure, a lot of my colleagues across the nation, we will be going into that environment as we look at state budgets going forward. So being able to say, how can we all get to our goals? Our goal at the Department of Higher Ed is reaching 66% educational attainment by 2025. So how can we work with other agencies to be able to reach that goal and to move that needle in ways that maybe we hadn't thought of just by ourselves? So being able to increase that impact, also increasing the efficiency by collaborating with a lot of different professionals and practitioners. So one of the main points of My Colorado Journey is really to not only make this available to any user, a student of any age or a worker of any age, to be able to go on and use this personalized experience, but also really make this a tool that high school counselors can use, that individuals in workforce centers can use, to be able to best direct people to resources, and also in some ways be a case management system so that it can help them direct individuals to things that might best meet their needs depending on where they are. And then, of course, in thinking about redundancy and reducing that, especially in the times of lower resources that are available. We, within state government and agencies, sometimes put a dashboard here or a tool there. And unfortunately, a lot of people don't use them as great as they might be. And so what we're hoping is that by having this collaborative approach, we can really reduce that redundancy and have things more in one central place. So next slide. And again, one of the main points of this experience is that we need to meet people wherever they might be. So maybe someone comes to My Colorado Journey looking for that educational and training opportunities. That's fantastic. And we can really serve them up with robust information that we have at the Department of Higher Education, that we get from our public and private institutions of higher ed, and also the private occupational schools and others that are on the eligible training provider list, or ETPL, in Colorado. Ways to connect to actual jobs that are in the field, working again with the Department of Labor and Employment to see what that looks like. Being able to really inform what someone's career path might be, depending on their needs, depending on their interests, and also being able to link them to basic services. So in the case of higher ed, what resources and public benefits maybe our post-secondary students eligible for, and how can we find ways to better connect them to those resources? In the world of higher ed, in a lot of ways, students who are eligible for these programs, it's acting as a third leg of financial aid. And so being able to really connect students to what that is. And again, designing a system and an experience that people can start from any one place and get to other places. So it's more nimble and definitely more flexible for whatever their needs might be. So next slide. Again, the various components of this is this personalization engine, which really helps to link individuals after taking a short assessment to what they might be interested in terms of those education training providers, maybe human support services, and whatever that might be. So being able to have that user profile, also professional center, where we have various outcomes, goals, and steps built out, depending on what the individual wants and needs. And then undergirding all of this is the data trust. So as Matt had mentioned before, bringing all these partners together and saying that we have this use case, we have these needs, what is the agreement and the structure that we can bring together to really facilitate what a user needs, and how do we best leverage all the wonderful information and robust information that we have at state agencies, and being able to put that within this interactive experience. And so all of these things going together, but absolutely the data trust undergirding all of that work. Next slide. So in the time of COVID-19, as Matt said, we were working on all of this work with our partners and our partner agencies, and then COVID-19 came along. And so one of the things that we wanted to make sure we did was, one, preserve the very robust experience that someone might get in My Colorado Journey for the wide range of uses that they might need, but also being able to provide those resources, or a distilled version of that, into a more rapid response site. So we've been working with the folks at Onward US in deploying Onward CO, Onward Colorado, to be able to serve up some of these resources and also leveraging potentially aggregate level data or other data sets that those that are in the data trust feel, yes, we can rapidly deploy this, we can rapidly deploy that onto this Onward CO site, which then again is the rapid response, and then hopefully leading people into My Colorado Journey as needed. So things like training opportunities, whether those are in the public or private sector, different jobs that are available, again, working with our Department of Labor and Employment on being able to link people to jobs that are currently open and employers that are currently hiring, and then also those essential life services. So being able to say, here are various resources that are in your area, and being able to link folks to that. So again, being able to have all of these levers that we're going for the My Colorado Journey experience, thinking about ways to deploy them in a much faster way on this Onward CO experience, and through that, being able to guide people to My Colorado Journey to be able to receive that more robust experience and hopefully really meet their needs depending on where they are.
Great.
I think that's all I have.
That was fantastic, Michael. And in the interest of time, and so we can get to Sarah, we're gonna actually move the Q&A, combine the Q&A for you and Sarah to the end, and go ahead and move on to Sarah. So if you go to the next slide, slide after that. Great. So now Sarah's going to really tee up challenges and opportunities really unique to COVID-19 and the challenge of contact tracing and how to think about this responsibly. So Sarah, take it away.
Sure, thank you. Can we advance to the next slide, please? So I'm from the Future of Privacy Forum. My specific remit is in AI and in data sharing. If you'll advance to the next slide. Next, please. So if you'd like to know a little bit more about what FPF is, where we come from, and what we can help you guys to do, specifically as you're trying to address the ethics of data sharing, which is where I fit in, please go to fpf.org. This slide gives you some information about who we are, but obviously our website will give you much more. Next slide, please. So one of the things we're very interested in now is in contract tracing. You can't go a day without in the news cycle without reading this more than once by a bunch. And we are now partnering with Bright Hive and a few others to try to think about how do we create an ethical data sharing system for contract tracing data. So as the previous speaker mentioned, there's oftentimes a good number of data types and sources that need to be aggregated in order to be able to give users a seamless opportunity to be able to figure out how to navigate complex situations, such as their individual response to a pandemic or their response to changes in employment situations. We expect that contract tracing data is going to include things that are not only those that are drawn from apps, so mobile phone application data, but also that data that is gathered through the in-person epidemiological contract tracing. And as our speaker from Allegheny County can point out, and the many speakers in the chat can point out, this is going to be a lot of different forms of data. This is going to be things that are going to be difficult to knit together, and finding identifiers that can link together databases is going to be something of a challenge. But that technical side aside, next slide, please. The biggest question that we're facing and what we're coordinating with you guys on is in talking about how to establish something like a data trust. And for those of you who aren't sort of thinking data trusts every day, and this isn't a term that you're familiar with, there's a fairly brief description of this here up on this slide. And as our previous speaker mentioned, these are already things that are in operation for services in states that you may be part of, a citizen of, so Colorado. But it's also something that is a very common form of data sharing archive or data sharing agreement in a range of different organizations, whether or not we're talking about social science research, healthcare research, say with Open Data Institute, or personal identity data, such as with Digime, or even things so pertinent to those of you in the Western states. The Grower Information Services Cooperative is a tremendous data warehouse for agricultural data. So as we start to think about how are we going to open up the agricultural supply chain, this is an example of how a data trust is working to be able to respond to that. Next slide, please. So obviously within the context of contact tracing, there's a lot of nuance and a lot of speed and a lot of context we're going to have to consider. Obviously, some of the data that we're going to be trying to manage in this is going to involve things like testing, right? And what type of testing may be related to pandemic responses. Certainly, there are numerous stakeholders that are involved here, and litany and changing every day regulatory and legal expectations that will come from this. Next slide. So how is it that we're going to help to establish something like a data sharing trust for COVID-19? This is where we're going to draw on some of the previous work that the Future of Privacy Forum is doing that I lead in terms of establishing an independent, objective, third-party evaluation system for research data sharing. So what we do is to try to stand up what it looks like an independent review board. So those of you who are social science researchers, right, you'll recognize the IRB label, right? We're trying to set up something that is an independent review board for sharing of corporate data, corporate health data, to researchers for the purpose of advancing academic research. We're doing this with some of the things that are imperative to data trusts involved, specifically establishing a very clear and principles-based charter. Some of the principles that we're operating under are those that are similar to those that are listed in blue on this slide: rule of law, transparency, accountability. You can see the AI ethics shining through there. Next slide, please. And what we're trying to do there is also to establish those things that Natalie brought up earlier, establishing a very good and robust governance structure. So transparent policies, procedures, protocols, being very careful about determining the terms of service, memberships, and having robust, transparent, accountable mechanisms for review of data assets and review of data requests. Because while we're talking today about knitting together data, we haven't really talked about what it means to take data out of a data trust, and it, not only in terms of the ETL implications of it, but also in terms of what do you do as a responsible person who has drawn from a data trust if you're going to use it for analytics. I see that I'm being asked to try to move even faster, so please next slide. So things that we're doing, and we hope that we can find some additional partners from this conversation on. We're establishing some data fitness assessments for sharing. All right. So one of the things that's gone on in the chat is a discussion of most of this data isn't interoperable. A lot of it's dirty, much of it's messy. HL7 and data on fire could help, FAIR, et cetera. There's a lot of different ways in which we could create data standardization. Where do we go? Right. That's one of the ways that we're trying to help to speed this up, but also research fitness evaluations. So how do you evaluate the fitness of the request, and also determining how to value some of the data assets that are being shared. We're talking about bringing data together, but we're not talking about the fact that when we bring data together, we bring money together, and then people start to get a little bit concerned. So next slide, please. So one of the things that was also brought up at the very beginning of this call, and I will then end on this slide, is how do we make sure we're not duplicating efforts. So for example, how are we going to interface with some of the data lakes that are being established around COVID-19? Those are say by Johns Hopkins or C3AI. There are extraordinary data lakes that are being carved out here. How do we ensure that we don't duplicate, but we complement if a data trust is established at the state level or at a county level? And finally, how do we interface with research repositories? Before I was at FPF, I've been a longtime academic researcher, so I'm very interested to make sure that the things that we do have long-term viability in terms of advancing our generalizable knowledge about pandemics or about social determinants of health, for which we need to be worried about interfacing with things like ICPSR and other research repositories. So there's obviously a lot of information that I could additionally share. I look forward to some of your questions, and let me turn it back over to Dan, Matt, for moving the conversation on. Thank you.
Great.
Thank you, Sarah. That was quick. a lot of information to cover. Fortunately, it's captured here. We'll go back to it. I do want to mention, though, for folks who want to hang on for a little bit longer, because we don't have that much time to talk, we can extend this conversation. I know folks have committed a bunch of time already, but for those who want to stick around, we can hang around for another 10 minutes or so and engage in some conversation. Our presenters are also available. I'm not quite sure about that. But so let's open the floor right now for some of those conversations. If anybody wants to raise their hand or unmute and jump in, that'd be great. Otherwise, I have a couple of questions I want to ask as well.
I know there was a question in the chat for you, Sarah, which is FPF doing any research on blockchain-based solutions to the data privacy issues being discussed? How do you see kind of blockchain in that whole world kind of connecting and interacting with especially contact tracing?
We're trying to be as ecumenical as possible at looking at the possible solutions to things. Blockchain is one of a number of tools that can be used to try to create more trusted data architecture that could go into a data trust or any other type of organization of data. Again, though, blockchain is just one of a set of alternatives. So,
yep. There's some good work by a nonprofit called Safe Path Check International, or Safe Paths, out of MIT, that has been exploring some of the blockchain specific things. So if you're interested in that, we'll put in some links in the chat for some of that. Daniel, it sounded like you had a question you wanted to pose.
Yeah, and I think that comes up with Jane's question to a certain degree here. I know that when we've talked in the past, different data, sharing different data both for case management purposes versus for de-identified aggregate data and research and policy are two different worlds, related, obviously. And I'm curious also for Michael in particular. When we get into this world now of data sharing, it's one thing from a policy perspective. It's another thing when we're talking about how do I use this information to actually make a decision in a real-time or near real-time kind of environment. And I know we're talking about employment data here and childcare and school data, which is a set of data. A lot of people on this call are thinking about child welfare data and thinking about, very protected health information kinds of things. So I'm curious about how you're thinking about sort of the expansion, sort of the spectrum of how data trusts work, how you're thinking about that, are there boundaries to it? And then part two will come later.
Sure. So, so in terms of maybe more of the programmatic, kind of how I describe it, is the programmatic things that state agencies might need to do. So maybe that is providing this tool or providing some sort of guided experience to an individual to help direct their needs. I think within the context of doing that within the data trust that Bright Hive has helped us set up, we've been able to maybe use identifiers in a way that we are potentially linking from one data set to another for that specific use case. And so because it's all within that secured lake and we're all agencies working together on that front, I think it's been a little bit easier. Of course, depending on the partner, there might be HIPAA, FERPA, additional things that we have to think of and navigate, and that might limit some of the things that we can do. But I think for that agency programmatic lens, it's been a little bit easier. Additionally, because the output is usually some sort of aggregate level data, is some sort of summary experience or some kind of summary of what is going on across agencies. So it's not as much at the individual level when we're thinking about that programmatic application. When we're thinking about more research, absolutely, that does get more down to an individual level. And we are very careful in following FERPA and of course HIPAA and all the other things in terms of compliance. I will say the Colorado Evaluation and Action Lab, which is located at the University of Denver, has done some great work in terms of the Colorado ecosystem in helping facilitate that back and forth between state agencies and researchers to be able to do rigorous academic research that helps inform policy. And being able to do that by de-identifying data and again, linking data within the state's ecosystem so that the linking isn't being done by an external person or an evaluator, it's all being done within the state. And so I think that helps with those two different kind of use cases.
Great.
So this is Dave Walsh. Question that I have, as we're looking at Project Unify, bringing together different domains of information, it would seem like you all probably have the same or a very similar problem in person matching. In other words, is Pete Sloan in System A the same as Peter Sloan in System B? So that's a problem that's going to plague many, many systems as we go forward. Are you all looking at common solutions? How do industries, rather than very narrowly, how do I implement that in my system? Broader speaking, how is this problem addressed?
Yeah, I can briefly hit on this, and then would love to hear from other folks. So in almost all of the trusts that we've been involved in, you have member contributed data resources and then trust managed data resources. And almost all of them, one of the trust managed data resources is a master client indexed or a master person index. That's the kind of identity or entity resolver. But as you well know, this is a very, very challenging thing to do when we have kind of at least in the U.S. a system where the only real national ID we have is Social Security number, and that's tied with a whole bunch of other kind of both legal and technical challenges to use for resolution. So there's some great work happening internationally on ways of resolving this that are really going to depend on uptake. But you have new protocols for identity like the DID specification, that's a World Wide Web Consortium specification, something called a distributed identifier, that is probably one of the most well thought out ways of doing this. And a recently launched foundation called the Trust Over IP Foundation that will provide links into this that's really laser focused on solving some of these kind of shared identity challenges that cut across all spaces: health, education, finance, etc. And so I think those are two centers of gravity that are building on a lot of other few decades of prior work on resolving the identity issue.
Super. Any progress that you make on that? This group that's working on Project Unify would like to share your findings, and we're happy to share what we're coming to understand of it. Thank you.
Great, and I'll make sure to connect you guys with the executive director of the Trust Over IP Foundation. I think they would be very interested in collaborating on this, especially.
Love to hear from
them. Dave, I appreciate that question. It's been something we've been sort of struggling with or wrestling with now for 6 months or so, and especially if people are outside of the systems, right? It's one thing if you're sort of co-locating the data. When you're talking about systems that are actually separated, trying to identify those individuals, it is a significant challenge for systems in order to make sure we're talking about the right person. So it will be
and we've all got that challenge.
Right, absolutely. One more question I have, I don't know if anyone else does, but one of the questions that's come up a lot now as we've been talking about data sharing and being sort of enthusiasts for this is, what about people who don't want their data shared? And in the environment that we're living in these days, especially, well, it'd be interesting to see as it evolves, but certainly the last year or so, from at least anecdotally, there's been much less interest in, but there's been a significant interest in not being incorporated or not being involved with data, sort of government data systems. We're seeing reductions in the uptake of SNAP and food stamps and all sorts of other things like that. It's a vexing problem. It's a very deep problem. There's a lot of talking about trust issues. How do we help people understand, or how do we ensure that the data we're asking them for actually would be private? And how do you, I don't even want to say convince people, because I don't think you can, but how do we address those issues when we're talking really about some of the most vulnerable populations out there that don't want to necessarily be known?
I'm curious, Sarah, do you want to take that one on?
That's such a difficult question. I will lean on a phrase that our CEO, Jules Polanetsky, kind of uses a little bit. Privacy is a religion, and our ways of thinking about it are tied deeply to some of our core beliefs, and attempting to convince people to change their core beliefs can be tough. So that aside, trying to assure people that when their data is shared, whether or not from a corporate platform to a research platform, that there is some sort of governance, giving people the idea that there is transparency and policy procedures, due process, and that it's governed by principles that, regardless of their general sense of principles and worldview, they can get on board. So notions of substantive justice is one way to go for that. But I do believe that you're probably right. There are a good 10% of people on the far ends of either tail that are never going to be convinced that sharing their data is going to create redounding good effects to them, and may actually lead to deleterious effects to them personally. Relying on the good faith of the muddled middle 80% may be as good as we get. And I guess a reasonable question is kind of that data scientist question: must we have n equals all in order to have something worth it at all? I don't think that's the case.
I think I'll just briefly add to this that I think this has come up a lot, especially in the application of data trust to contact tracing and building it. We mentioned at the top of the call about having a set of guardrails and concrete set of kind of privacy principles and ethical principles that are embedded into the data trust construct that have actual teeth. And when looking at kind of FIPS best practice, so fair information practice privacy principles, things like notice of awareness, choice and consent, access, participation, enforcement and redress, like these are critical things to establishing and maintaining public trust for the kind of middle part of the distribution, for whom they're going to update their beliefs about whether or not their data is being held in trust based on what they actually see.
Yeah. So that's actually a great transition, to some of the work that obviously you guys are going to be continuing to do. We'll love to hear more about them, and we invite you to blog and post to the next site. For folks who have not yet gone there, you'll find a lot of material, as I said, from prior events. We've got a number of ones on confidentiality and privacy and data sharing, and there's a good body of knowledge up there, very current for our challenges today. I think that also, the whole question of governance and what that actually means to me as a user, as a contributor to data or a consumer of data is really, 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 really important. And so I'm looking forward, as Matt said early on, or I think Natalie said early on, we're looking forward to working with Bright Hive on actually making that available as part of a training curriculum that will be coming out pretty soon. To help people really think about these things, because it's, not everybody can be at webinars every week. So making sure this kind of complex information is made available and can be spread broadly across organizations. So we can grow and build from the knowledge bases that we have and that we're building on. So we look forward to doing that and sharing more of that with everyone here over the next couple of weeks. And so with that, Matt, I don't know if you had any final words. I'd just give that back to you for a second, and then we'll close out.
Yeah, I think the last thing we'll share is that we talked about, we're developing 3 Creative Commons playbooks over the next month or so, one of which we are doing with Future Privacy Forum, specifically around data trust for contact tracing. We will be posting those to the, links to those when they're ready to the NIC community and on Twitter and all the other places you can find us and FPF, and hopefully that can be a forum where we can continue to share learnings from great places like Allegheny County and the state of Colorado as well. So thank you all so very much for allowing us to share with you what we've learned to date, and for our ability to learn from you as well, from the great work that you guys are doing. So thanks again.
Thanks a lot, Matt. Thanks for everyone who's presented today. As we said, we'll post the materials. We look forward, if you have questions, we'll invite our Bright Hive folks to come back and our other presenters and speakers to add their commentary. Feel free to reach out to folks. The PowerPoint will be posted as well. And we look forward to seeing folks next week. This topic is of interest. Next week will be of equal interest in terms of how do we actually build stuff that's replicable, different model, but another way of actually getting into some of the more private information that's available as well. So with that, have a weekend, as we say. For those of you who are out and about, enjoy, wear your masks. For those of you who are remaining close to home, I guess you can take your mask off. I don't know. With that, though, it's great fun. It's a great pleasure to be able to sort of look forward to this every week and have folks participate and join and share information. So thanks for joining. Thanks for spending time with us. Thanks for going over a little bit. And we look forward to seeing you next week and beyond. Have a great one. Thanks, everybody.
Thank you.